Hi, I'm Dr. George Sanders. One thing this ongoing recession has taught me is that even though you can't afford to have plastic surgery, you still want it. Well, let me give you a few tips on how it is that you might be able to afford the unaffordable. First of all, do your homework. Know exactly what it is that you'd like to improve. That way, when you go to the doctor's office and he gives you a list of 8 things with a price tag to match, you'll be able to sort through those and come up with something that's going to make you happy and not break the bank. Secondly, refer a patient or two to the doctor before you have your consultation. You'll be in a much better mood to consider your request for a decrease in the surgical cost. Thirdly, be willing to have your surgery on call. By that I mean if the doctor has a cancellation in his schedule, be willing to take that spot with little or no advance notice. That'll almost certainly earn you a discount in fee. Team up with a friend who would also like to have plastic surgery. If the two of you elect to have surgery with the same doctor, you'll almost certainly find that your surgical fee will be less, but don't expect to get 2 operations for the price of 1. You might also want to consider doing a bit less than is ideal. For instance, say you go to the doctor and he recommends a neck lift procedure, but he also mentions the possibility of a less involved neck lift that costs a bit less. Maybe it doesn't give as much of a result, but the result is still good. You might want to consider the less costly alternative. And finally, consider having your procedure done under local anesthesia. Many procedures can be done that way. Upper eyelid lifts, ear setbacks, even liposuction. And by doing things without an anesthetist, you'll decrease the surgical cost. This is Dr. George Sanders speaking on how to afford the unaffordable.